So Dr. Haj Ali, we have some questions from patients that we've been gathering since we knew we were doing this webinar on CNS. So I'm just going to ask you a few, but I think I'd like to start with asking you to talk a little bit about the plan to have multiple research data centers to compile and study CNS. You touched on that a little bit. Can you elaborate on that a little more?
Sure. So, we in the vasculitis community, we have a consortium called Vasculitis Consortium, which govern multiple big institutions who have vasculitis centers, and through the consortium we actually invite our patients to different studies that mainly collecting information from them from their journey, as well as taking samples from their blood and other samples as well. So we're very excited about this. There has been multiple efforts in the past to put together some kind of like a data information for patients with CNS vasculitis. And because of the rarity of this condition, it has faced multiple challenges. But we are really very excited with having this initiative through the VCRC, and we're almost done with prep work with this, which will going to include to invite patients who come in with the major institution who have vasculitis center to be invited to be part of this. So patients will be asked if they would be willing to give clinical information, information about their imaging, information about their biopsy, and if they give blood samples. And if we collect information from different institutions about all these patients, we are going to go ahead and start some studies, looking specifically at different aspects of this vasculitis. At the same time as we are forming this group of investigators that are really interested and have experience in this disease, we are going to have some reforms of how to make a diagnosis of CNS vasculitis, because this is going to give clinician guide on how to make a diagnosis and when do we call it for sure and what to do in these instances, etc. So it gives kind of like a guide for clinicians for this rare disease, and that will help to get a earlier diagnosis as well. And through the journey also, we are going to have certain criteria on what is mean to be in remission, what modalities you will really look into to define that remission or relapse, etc.
Well, what a great collaboration that sounds like. I'm sure that we can only benefit from that, and I appreciate you elaborating on that a little bit further. We also had another question about the different treatment approaches or differences in how you treat pediatric versus adult patients with CNS, and are there challenges in trying to diagnose pediatric versus adult CNS?
So pediatric CNS vasculitis present a little bit different, and patients with pediatric CNS vasculitis may not need longer treatment than adult patients with CNS vasculitis. And we are very fortunate for Dr. Bensler's all research and input in this condition, who really looks at pediatric CNS vasculitis, and we've learned a lot from her. So it's a little bit different, yes, and the treatment may not be as long as patient with adult CNS vasculitis.
Well, great. Thanks for, again, clarifying that a little bit. I was just thinking that there are patients like Chris that are going to watch this and are going to wonder, are there trials that are currently recruiting patients with CNS? If you're a patient and you're willing to participate in a study like that, how do you do that?
Not yet. We don't have any ongoing trials to recruit. Hopefully this will be down the road as we understand better this disease through the effort that I just talked about.
Okay. And then I think another thing that came up, Chris touched on this a little bit about her experience with trying to work and going back to work and the frustrations of it. And can a diagnosis of CNS prohibit someone from doing certain jobs or careers? This one patient said, my son has CNS and he would like to eventually become a pilot. So would having something that can affect cognitive function rule him out from certain careers?
So, it depends how much, deficit the patient has, and not everybody is the same. So it's really very hard to answer this question. And it has to go through some cognitive testing and other testing that are required for that, specific job. I have patients with CNS vasculitis who don't have deficit at all. And there are patients who have a lot of deficits. So it really depends on their specific disease, and cannot generalize on that.
So talk to your doctor as usual and let them evaluate you properly.
Absolutely.
So Chris, you've told us in your both in your book and in today all about your journey, and I think as a patient, I love hearing other patient experiences, and I enjoyed your discussion back and forth with Dr. Hajali. But just so we don't miss anything, do you have any questions that you'd like to ask Dr. Hajali about yourself or other patients?
Thank you. I think the one question that came to mind for me is, and I've heard other people ask this before, I personally went to a plant-based diet about 4 years ago, just from a perspective of, I've read a lot about it reducing inflammation. And I had flares every couple of years with my vasculitis. And in the last 4 years, I don't know if it's, just by chance or what it is, but I haven't had a flare, and I feel like it's really worked for me. But I was curious if there's any studies that have shown that, or what you're doing in that field at all, if anything.
That's a great question. And our patient always ask, what should I eat? What should I do? What should I follow? What kind of diet? And, what you did is you probably did a anti-inflammatory diet. Has there been any studies specifically in CNS vasculitis looking at that? The short answer is no. But, any measurements that you take that has a effect on less inflammation in your body is actually going to help you. So at this point, there is no specific scientific answer whether it works or not. But I always tell my patients, if it doesn't hurt you, do it and try it. And in the process of taking care of yourself and eating better, you are actually going to do other measures to take care of yourself, because that will also lead to better exercise and mental health. And they're all now connected together. We know for sure that inflammation in the body by itself, and by not eating well, and by not sleeping well, or just by not feeling well, it's actually increased inflammation in the body. So by just controlling these factors, that's really a plus in our management.
Thank you.
I'd like to just say thank you so much, both to you, Dr. Hajali, and to you, Chris Kelbrantz. Thank you so much for spending your time with us. Chris, you telling us your journey, and Dr. Hajali, keep doing everything that you're doing. We as patients appreciate you so much. I'd also like to make sure that I mention that, as I did at the very beginning, that Chris has written a kind of an amazing book called Maze of Thorns. Did I get that right, Chris?
Yes.
And it is available on Amazon. I can tell you because I got it from Amazon. So it is, it talks about quite a journey that she had, and it's kind of amazing collaboration between her and her mom. So I just want to make sure everybody knows that book is out there and something great to read. I also want to especially thank our sponsors, Chemocentrics, Genentech, and Amgen, for their support of our Road to Wellness webinar series. They are helping the Vasculitis Foundation provide these valuable educational webinars and support our commitment to patient education.